This is Dr. Bill Wyatt, and it's a little late at night, but I'm going to try to do this video on the importance of follicular movement of teeth. You really need to understand about follicular movement. I want to get this where I can draw and show you what we're talking about. You can take somebody who is functioning normally. You can't take somebody who's got a mouth breathing problem or a thumb stuck in their fingers or some quirk they're doing that's make their teeth grow wrong. That it might work. I mean, as far as having too many teeth or something else. Now, in the case that I wanted to show you here, you have somebody in the family that's got a large tooth, and you've got another member of the family that has a smaller facial structure and everything, and the person with a smaller facial structure gets the skin from the other person, and the teeth come from the same exadermal layer that the teeth come from. And so if a person has a certain type of skin, like from some Indian person or something else, then their teeth will be the same as the person with the skin that matches up. And that just happens all the time. And we need to understand that. And then if you get somebody that's breathing correctly, they keep their mouth closed, they breathe through their nose, they're not allergic to a bunch of things, and in other words, they're just pretty normal kids or people, you can do things to the teeth and let nature kind of move the teeth around for you. And the follicular movement is kind of like what nature, how that moves their teeth. It's so complicated. I wouldn't begin to try to explain it. I don't even know enough of it to explain it to myself, but it is very complicated. You have a little follicle. Let me get on the first x-ray here. And this is a young lady that I saw back in 1972, and I was working on her father, and he wanted me to do her too. And so I took this picture of her in 1972, and here are what I came to the conclusion was that one parent had large teeth, and they didn't fit this young lady. And so we're going to try to reduce the teeth in the middle of the road here. The wisdom teeth aren't showing up over here. They don't show anything over there. You can see the 12-year molars. Here's the 12-year molars. They're forming good, and these are the 6-year molars. And we're going to start this case. Now, if we don't need all the space, these teeth will drift forward and you'll have more room for the wisdom teeth. I'm not sure at this point whether I save the wisdom teeth or not, but we'll see pretty well as we go through this. Now I'm going to come in and eliminate these baby teeth right here. That was a permanent tooth, and the permanent bicuspid down here. And watch what the follicle does. Now, the first thing I want to make sure that everybody knows what a follicle is around the tooth. And I am sorry if you understand all that and you don't know it, but there'll be a lot of people won't. I won't kind of draw the thing. I think of the follicle maybe as a balloon or something like that. And the tooth starts to form in here. And this balloon is attached down here somewhere, and it fills with liquid. This is an epithelial material, and it becomes the outer layer around the edge of the tooth as it comes through. Now this material will let liquid come in, but it won't let any liquid out. It can't go out. So this thing gets bigger in various people And the thing, it's like, maybe if I could explain it like this, if you had a balloon and you blew it, you could get your hand in it first, and if you could blow that balloon up and fill it, just blow it up with water, and you had it in a swimming pool, and you say, if you had a wall of a swimming pool right here, and here you would have your fist in a balloon, just that'll be a fist, and the balloon is tied here, and it's full of water. If we push this up against the fence, the wall of the swimming pool here, it would flatten this out like that, and we'd have to push on it to do it to kind of flatten it that way. If you took your hand off of this side, then this part that got flattened out would round out again, and that would move your hand in this direction. And that's the way nature moves teeth. And I want to show you that real plain before you get through with this. If you want to learn about it, it's going to take me a little while to explain it, but we can go on and go through this, and I'll show you that. Now, let me go back to, that was 1972. That's our first one. And so this is what we're planning to do. Now, this cuspid right here is right up against the lateral root. You see the permanent lateral coming down. Here's a permanent lateral, and this cuspid is right over underneath this lateral. And this is a deciduous cuspid, and that's a deciduous tooth right here too. So we just kind of watch it at that point, and now we're going to come back later and we look at it. This was 19, we'll skip this was 72, 4 of 72, and here we go 4 or 5 of 73. So it's 4 of 72, and we jumped about a year in here. Well, it is a year. We jumped a year, and this is the way it looked, and I saw her back, and I had taken out some of the baby teeth waiting for this to come in. And so this did come in, and this cuspid tooth right here is growing in, and see the follicle, how big it is around that cuspid tooth. Now it kind of mashes in on this side. The follicle will not eat away anything, but it pushes against bone, and bone just kind of moves out of its way. I've seen people in Africa where I had one policeman had a cyst here as big as a hen egg, and it was caused by a follicle on an impacted cuspid right here. It just was a big thing here. And if you open it up and keep it open, don't let it close, the pressure will go off. And I filled it with gauze, and the guy would come back every week or so, and we'd pull that iodoform gauze out and put more in there, and we kept doing that, and this thing just finally just shrunk up to nothing, and his jaw looked pretty normal back in that shape, so his jaw went back like that. So this follicle is pressed there. It's pressed in here, you see, and you've got a tooth here. We're going to take this tooth out, and now this tooth will move away. That'll move away there, and this as it moves away, this lateral will straighten out. And this is just the way nature moves teeth around, and it does a lot of different things, and you need to kind of understand it and use it when it's where you can. If you got somebody that's functioning normal and their teeth are not in a big problem like that, you can do this. All right, you can see these follicles down here, how they're rounded out of the teeth. And now I'm going to go to the next picture, and this is in 73. So we went from 5 of 70, let's see, it was 5 of 73 to 7 of 73. Now this is just 2 months since we took that other picture. Look at this follicle here, how it is rounded out like that. And this one is coming away from the teeth pretty good. The tooth's kind of following it in here. And this follicle is down here, every one of them. You took the pressure off of one side, the tooth's moving in that direction simply by that gentle pressure of that sac that's full of fluid around that tooth. We call the follicular tissue, it's epithelial tissue. And when that tooth opens into the mouth, it opens out, this epithelial tissue ends up around the neck of the tooth, and it serves that way during your lifetime. Now let's go on to another picture here. This 7 of 73, and just remember where those follicles are. And now this is January of 74, so that was 7 and 5 and what, about 6 months or so. Look at where the teeth are now. This follicle is a round ball right here, and this one is too, and they're still having pressure effect, though this one is pretty close to coming to the surface, and when it breaks through, this follicle loses its pressure and it just shrinks up around the tooth. Now down here, look where this is, and look at the space on there. Let me just drop this back for one time, and you see where those teeth were. If you look at those spaces, now we're going to move forward, and you see the space. All right, let's go on to another Panorex that we took. Now we have not touched this young lady with anything except back then I did take the baby teeth out, and or else got somebody to take the permanent teeth out, but we probably did that too. Now, if you go from 1 of 74, let's go to 2 of 75. So this is a year and a month, and look at what the teeth did. I mean, these 2 teeth are straightened up, and they're coming right down into place, and they'll bump these teeth and push them together. These teeth have come off. Look at these teeth now. I'm going to go back, and you look at them, and look, see the gap in there. Now here's a 1 year and 1 month later. We're going to look at them, and those teeth are like that. Now there's a piece of root down here. Don't worry about it. A professor or somebody in oral surgery saw a piece of root like that, and he had me dig it out of the person's jaw, and it was not necessary, the blooming thing. This will just go away right there, and you won't have anything. Now the follicular movement, or the cells in the follicle, will eat the dental structure away, but has almost no effect on the enamel, and it'll eat all the dentin out from under that tooth, and it'll just be a kind of a hole when it comes out, and you can see that, and you watch, everything is moving together now in the whole space. It's coming in from over here, and it's making more room back in this area where these teeth are coming in. They're shifted forward here, and this is backing up just slightly to come in there. So if you've got a little extra fullness, it'll go in slightly, but not a great deal. Now I'm going to go to the next Panorex. It's number 6, and here it is at 8 of 75, and there's only one part of a baby tooth here, one here, and this hull of one right there. Now, this tooth is turned sideways. There's nothing, and this one is too. When that tooth gets in there, if unless it hits and bumps around to its own side, straightens out, it will have to be rotated. Now, a lot of things have to happen. Our wisdom teeth are developing back in here, and they'll have a little more room to come in when you get through than it would if you'd have left the teeth there. They were crowded. You kind of expanded them. You'd had to take out the wisdom teeth. So let's look at number 7. And here number 7 is, and this is without doing one thing orthodontic. Well, the whole thing is a smarter way to do orthodontics, really. I mean, you can figure out how nature's going to go and let nature do the orthodontics, but it's hard to convince people that you're having an effect on it. You'd have to show them all this stuff and everything. And you can take somebody and just take them through. This is what we call a serial extraction case. But you can do this kind of work on people that are they work for the oil company, and they're in Saudi Arabia, and you can't see them all the time, and you can take their kids and a lot of times do something like this for people. I did this for a doctor's daughter who was in Nigeria and couldn't see anybody, and her teeth came in nice. He had her touched up again, like I'm going to do that to this case right here. So look at this, is number 7. Now this is the last Panrex we'll take. And all this has taken place, and I haven't put one band or one bracket or anything on her, and this has happened. Now, if you can understand this little bit of pressure, and those teeth will accept that pressure and move in the direction. If you got something hard up against one side, there's nothing over here, the tooth will move over it. You push it up against it, it'll flatten that follicle out, but it's just like that balloon full of water. You flatten it out, you take your hand off, and it's going to again assume this round shape that it's in, and it'll move the tooth over, and sometimes you can get all you want on it. Now I was working on her dad, and he liked them all right. You know, we were finished here in this is 1995. This is after we had finished quite a time, and here is his 1979. The teeth settled down a little bit. The bite closed slightly, but we've had no retainer or anything. She just went without. And the reason you can do that, the tongue pushes those teeth out, and the cheek and the lips pull them back in and hold them here. And if you got somebody that's functioning correctly, the function straightens the teeth out. I mean, it goes in and moves the teeth, especially those that are flat. You take a round one, it's harder to get it to rotate. Now this has got the midline, is right down the middle of the thing, and we come back and put some braces on her and finish that up. I think I'm going to show you the model, the shape of the model. I think this is 95, and there it is in 79, right there. That's the upper arch. And this is the lower arch, and this didn't work out too hot right here, and this was 95. So that has relapsed to that point. And there it was in 79. Now what I should have done in 79 is put a bonded 3-to-3 on there, and then this would not have happened. But this slid by that far, and the thing got a little off, you know, not a big problem with it, but it did slip that much. It would have been better to have put some kind of fixed retainer in there. So anyway, I hope you get enough from this video to do this sometimes. We call it serial extraction or follicular movement, and you use follicular movement to just do small things, and it's part of your braces and the bands and brackets and stuff that you put on there to move the teeth. And I hope each one of you get something out of this. And we could have done that. And here's the young lady. This was 1995, I think. And she's got about 20-something years old, and she came by to see me, and I took a couple of pictures of her, and she was real nice. And we straightened her teeth up without doing anything that you would call bonded or attached orthodontics to the teeth. And you can do that too. So I hope you'll get something from this. Join our group and subscribe to it. We'd like to have you. And I'm going to sign off and say good night. And it is night, so I'm going to go to bed. But I am grateful for the group that we have working with this, and I hope that this helps them out in problems that they might have. So thank you for watching again, and I'm going to close this out. So good night.